Good morning, everyone. Today we are going to give a presentation for class Aboriginal and Torres grade health. There are three group members in our group. There are Tanzima, Y, and Shan. Our topic is the health promotion for diabetes mellitus for Aboriginal and Torres Strait Islander population in a remote area in New South Wales. We'd like to begin by acknowledging the traditional owner of the land in the remote area in New South Wales on which we present this PowerPoint. We would also like to pay our respect to elder past and present. There are three aims and objectives for this presentation. Consumer will discuss the links between culture and Aboriginal and Torres Strait Islander health. Shan will explain and identify relevant Aboriginal and Torres Strait Islander social determinants of health that impact diabetes mellitus. While will critically analyze considerations for culturally competent and safe nursing practice in relation to health promotion of diabetes mellitus for Aboriginal and Torres Strait Islander in a remote area of New South Wales. This PowerPoint is to deliver and improve primary health care to remote indigenous area to try and achieve better outcomes in diabetes mellitus that is affecting most of Aboriginal and Torres Strait Islander, especially in the remote area. Health promotion is the method and practice that used to promote the physical, psychological, social, and emotional well-being and prevent the harm of diabetes for the Aboriginal and Torres Strait Islander. Diabetes is a chronic disease that caused by the high level of glucose in the blood. Type 1 diabetes and type 2 diabetes are common. The Aboriginal, Torres Strait Islander, and people who lived in remote areas have higher rates of this disease. The health context we chose is remote. Remote area of Australia is measured by the actual distance of people living in remote to the main service centers where basic amenities are found. Remote area of remote resident, all more or less, has similar issues regarding health care service and the quality of care they receive. The area of remote is the second largest land on Australia at 1.02 million square kilometers, which is 13.2% of total area. According to the statistics, remote area of Australians has a population of 324,031 Aboriginal and Torres Strait Islander. It is 1.48% of their total population. 25% of all Aboriginal and Torres Strait Islander people in Australia live in remote, compared to 2% for non-Aboriginal and Torres Strait Islander people, due to their distance to healthcare provider, availability of proper facilities, lack of well-trained healthcare workers, and so on. From the survey in 2014 to 2015, people living in major cities were more likely than those living in regional and remote Australia to have visited a general practitioner in the last 12 months. The proportion of adults involving in lifestyle related with poor health, such as tobacco smoking and alcohol misuse, are also much higher in these areas rather than urban areas. Higher rates of indigenous people live in remote places, which can be related to low socio-economic position. Health promotion is the healthcare needs we'd like to talk about. Health promotion is a process to enable people to increase control over or improve their health. It includes interventions that are used to reduce the harm and protect against the cause of disease. Health promotion at individual and community level includes personal health education and programs, such as weight control campaigns. It is significant as it helps people to be more confident about health literacy in order to achieve the best health outcomes for both individual and community. Health promotion empowers individuals to be more familiar with the concept of health and the prevention of disease. It is also an effective tool for community to promote health and gain the goal of health. For nurses and other health professionals, advocating and teaching health based on understanding of the community's health goal can be used as the method to promote health. For instance, nurses have to provide supported information for patients to optimize health-related decisions, which provides safety care. The health issue adopted is diabetes mellitus. According to the population survey for Indigenous Australians who lived in remote areas in June 2011 were 21%, compared with those who lived in urban cities or regional areas were 79%. In the survey between 2012 and 2013, Indigenous adults who lived in remote areas to have diabetes mellitus were 21%, compared with those in non-remote areas were 9.4%. Many Aboriginal and Torres Strait Islander people live in remote areas where health service and public transportation are limited. The proportion of Indigenous people living in remote areas are more likely than those lived in urban and regional areas to experience overweight, obesity, and multiple health issues because of lack of exercise, smoking, unhealthy diets, and lifestyle. All those factors are risk for type 2 diabetes. Related long-term illness can have negative effects on social well-being, such as anxiety and depression. They can lead to greater psychological distress and impact individual, family, and whole community. Furthermore, they can impair their quality of life. Now, we start to discuss the details of aim and objectives for this presentation. Linking culture to Aboriginal people, health is a multidimensional concept. This impacts their aspect of living and stresses in the importance of survival in the environment. The traditional health belief and Aboriginal life are about the land, kinship obligation, and region. As they have huge cultural difference between themselves and the mainstream, healthcare professionals often experience difficulties providing appropriate care to them. This belief interferes their behavior and health. For example, the rates of diabetes mellitus in remote Indigenous people is higher than in urban areas, especially in remote areas. This is due to their tragic history, social impact, which has influenced their behavior, lifestyle, eating habits, and conception towards non-Indigenous culture. This often works as barrier for them and the modern healthcare system that it is able to help them in improving their poor health condition. Thus, healthcare professionals should be more careful and sensitive toward the special needs of individuals. 30% of adults in Aboriginal community are suffering from type 2 diabetes mellitus. Because of the economic and social aspect in Aboriginal in remote areas are more likely to develop diabetes. This number is significantly increasing due to lack of availability of fresh food, lack of transportation, low supply medication health service, and insufficient education health promotion. After finish the first M, we will talk about the second one. Talking about the social determinants that affect the life of Aboriginal and Torres Strait Islander people. Three crucial determinants will be pointed out. The first one is food insecurity. Food insecurity is one of the most significant social determinants that impacts the health and well-being of Aboriginal and Torres Strait Islander people who are diagnosed with diabetes mellitus. Food insecurity is the lack of access to nutrition and appropriate diet due to high food expense and low income. The failure to achieve enough food and diets are the main factors that lead to malnutrition, micronutrient deficiency, and overweight, with related health issues such as diabetes mellitus. Improving nutrition intake is a key element to protect against and reduce negative impacts of diabetes and cardiovascular disease. Linking to the low income, which is mentioned above, employment is the second determinant that influences the health of Indigenous Australia. The rate of employment of Indigenous people is continually lower than non-Indigenous people in New South Wales. Low employment will cause the low income, influencing the access to essential living needs. For example, it leads to the difficulties of maintaining health and obtaining food, which resulting in low health status and higher rates of associated disease, such as obesity and diabetes. Education is the last but the most important social determinant, as it can be the key to improve the condition of insufficient food intake and lower rates of employment. Education of health can be defined as learning experience designed to boost the understanding of health and well-being. There is reliable evidence reckoning that how low level of education is negatively connected to the poor health of Aboriginal and Torres Strait Islander, especially in the remote area. Higher level of education acquirement leads to better health for Indigenous people. As a result, there is vital need for food intake, employment, and education in the community of Aboriginal and Torres Strait Islander, and more specifically in the remote area in relation to diabetes mellitus. Next, we will discuss how to provide culturally competent and safe nursing practice. Professional nurses should respect, aware, and understand the perspectives of Aboriginal and Torres Strait Islander in culturally diverse, not merely on individual needs, even on family, community, and the population for whom they serve. Nursing should always be held accountable for the meeting needs of all culture follows government competency standard. Develop culture-sensitive planning program, establish strategy and revision by using critical reflective skill and evidence base that will assist in meeting targets to promote Indigenous health and cultural safety. Engaging and developing strong community partnerships, such as establishing Indigenous supporting team, consulting with local land council of Aboriginal and Torres Strait Islander perspectives are essential. Nurses should develop a critical understanding and building knowledge on communication skills when interact with Aboriginal and Torres Strait Island people. Respect their first language and use appropriate language to embed Indigenous perspectives. Understand and work with the basic community protocols, such as making introduction with warm, open manner, establishing open communication, and building positive relationships to engage in cultural security. In control, the concept of culture and different social determinants impact the health of Indigenous Australia. While learning about the link between health and culture and the social determinants help us to critically think about safe care provided to Aboriginal and Torres Strait Islander. Nurses need to know about the background and respect the culture of Aboriginal and Torres Strait Islander to provide patient-centered care when taking care of the Indigenous people. We now know that it is important to provide culturally competent care for Indigenous Australians through the research that is about health promotion for diabetes mellitus in Aboriginal and Torres Strait Islander population in remote areas in New South Wales. When taking care of Indigenous people with diabetes, nurses also need to teach and provide relevant information based on local knowledge to prevent from the harm of diabetes. After the research, we now learn that respecting the culture and the health belief of Aboriginal and Torres Strait Islander plays an important role in providing culturally competent and safe care. For example, we will not give a direct eye contact with Indigenous people because the direct eye contact might be implied in their culture. When we give the medication, we need to briefly and clearly explain the medication, as they may not familiar with Western medication. If patients feel hesitated or confused, we have to ask for the reason and respect their choice to refuse. Also, we need to document it and talk to the doctor so we can find out the most suitable care plan for them. We also need to understand and respect the health belief when communicating with the patient and their family. It is better if interpreter or the elder is involved. Within permits, cultural stuff can be decorated in their room or near the bed, so they can feel the connection to their motherland. As the information is updated every day, it is vital for us to keep learning the news and knowledge about Indigenous people. In summary, it is essential to learn about the background and respect the culture of the Aboriginal and Torres Strait Islander to provide culturally competent and safe care. Reference we used. This is our presentation. Hope you enjoyed it. Thank you.